Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, May 30th, 2022, Memorial Day. I'm joined today by Bridget Travinski, who's going to tell the story of her birth, which was complicated by HELLP Syndrome. As a reminder, we recently decided to include birth stories in this podcast, and we'd love to hear yours. If you would like to share your birth story, you can reach out to me through the website or email me at hw@healthfulwoman.com, or the old birth story email still works, hrbs@highriskbirthstories.com. For now, enjoy today's podcast. Thanks for listening. Have a great Memorial Day. See you next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Bridget, welcome to the podcast. How you doing today?
I'm good. How are you?
I'm wonderful. Thanks for asking. So thank you for volunteering to tell your birth story. I appreciate it. How did you come about our podcast?
So when my daughter was in the NICU, I had found you, and it was kind of nice to hear actual medical terminology and hear some, uplifting stories sometimes.
Wow. And then what compelled you to share your own birth story?
Honestly, I think, for awareness for others. We had some things happen in our pregnancy journey that at times I wish I would have spoken up more or louder, just to maybe try to have things be prevented and maybe not have gotten as bad as they got. And then I think the second part is just like others have said before that I've heard, therapy, honestly, just a little bit of therapy for myself, in all honesty.
We're happy to provide that for you if we can in any capacity. And where are you calling from? Or where am I calling you, I guess I should say?
Yeah, so we're in Morgantown, West Virginia.
Are you born and raised West Virginia, or is this somewhere you moved to?
No, we're both born and raised here. He is from Morgantown originally, and I'm from a town about 45 minutes away, Mannington. So when we got married, we moved to Morgantown.
Wow, that's pretty cool. We're talking about the birth of your daughter, Laurel, right?
Mm-hmm, correct.
And when was she born?
She was born June 8th, 2021.
Wow. All right. So she's a youngin'. She's almost one.
Almost one, yeah.
And so take us back to, I guess, 2020. So we're in the heart of the pandemic, right?
Mm-hmm. Yep.
So first of all, did you expect to get pregnant in the middle of a pandemic, or is it just like, well, we're home, what else are we going to do?
Yeah, so my husband and I, we got married June of 2019. We did the basic, got married, bought the house, got the dog during a pandemic. In between there, we're like, okay, it's time. It's time we can start trying. And we had the conversation. We're in a pandemic. Do we really want to go about this? But ultimately, it was like, no, everything will be okay. The world's still happening. So a little bit different of a time, but definitely don't regret that.
And do you guys both come from large families? Like, was having kids something that you thought, we're definitely doing this, pretty soon after you got married?
Yeah, we both knew that we wanted kids. He has twin older sisters, and I have one older sister. So not big families, but we both knew that we always wanted kids. We didn't want to wait too long after we were married. We wanted to start trying.
Right. And now coming into pregnancy, I just know because, we were emailing before, you had some health issues coming into pregnancy, correct?
I did. So when I was in college, I found through an exercise physiology course that I was in where I had high blood pressure. Really didn't, have any symptoms or anything when I was young that I really noticed. But we were taking it. We were, practicing on each other. And somebody said, "Oh, I think yours is kind of high." So the teacher came over and he's like, "Yeah, this is really high. Like, you really should look into this." So
oh my God, that was just in college. Oh my God, that must be terrifying.
It was. Went to the normal doctor and, got hooked up with a cardiologist, and he spent a lot of time, a lot of tests, and, wore a heart rate monitor for a little bit and really couldn't figure anything out except that, he thought maybe it was just genetic. Other people in my family had it. So he just kind of chalked it up at that. Got me started on hydrochlorothiazide and lisinopril.
Mm-hmm.
And once we figured out the dosage of what my body needed, it was controlled, and honestly had never bothered me since. Just take the medicine every day.
And then you said it does high blood pressure, hypertension. It runs in your family?
It does, yeah. And in fact, the women in my family typically get it after childbirth, but mine was found before. So yeah, it's very strange.
And now, since you knew you had this and you were on a medication, and you were thinking about a pregnancy, is this something that you spoke about with your cardiologist before you got pregnant, with your OBGYN before you got pregnant, all the above, none of the above?
So the cardiologist actually we weren't really doing annual meetups anymore. We had gotten to the point where he just basically said, at the time when you do become pregnant, you need to speak with your primary to get switched to something safe. So basically, that's all I knew. So literally, the day I found out, I called, had an appointment the next day, and she'd already had me switched to labetalol.
Mm-hmm.
It took a week or two after I was pregnant to figure out the dosage with that.
Mm-hmm.
But then once she figured that out, I was fine.
And again, she was a primary medical doctor or your OBGYN?
She was primary medical doctor. So I hadn't, when I called the OB's office, they said they typically don't see you until week 10.
Mm-hmm. Okay. And then when you saw the OBGYNs, did you have any expectation that you would see like a high risk practice, or were they comfortable taking care of women with hypertension? Like, what was the setup for your prenatal care?
Right. So I guess a little bit of background. My sister, she had preeclampsia with her son.
Mm-hmm.
And so, that was kind of in the back of my mind that, okay, maybe, you know, this could be something because I already have high blood pressure. And I had wondered going into that first appointment, are they going to be comfortable with this, or are they going to refer me to somebody? And they didn't at the first appointment. They thought that they had taken my blood pressure there. They were asking me because I was taking it at home and monitoring it before I came in. It had been fine, and they thought that they could adequately monitor me.
Mm-hmm.
The only thing that they did say was at that very first appointment, actually, that their thinking was that they would probably induce me around 38 weeks if I hadn't already gone to labor, just because it'd be safer for both of us. But other than that, it was, they didn't really seem too concerned.
And then did they change any parts of your prenatal care? Like, did they put you're obviously on your medication. Do they have you taken extra vitamins or a baby aspirin or have extra ultrasounds or anything like that? Or was it your impression that they did that? Sometimes you don't even know, right, what's normal and what's not. So it's hard to say.
Sure. So nothing at the beginning was different. Nothing really changed until I ended up getting COVID at week 15.
Mm-hmm.
So the first appointment I saw them at week 10, everything was normal. They didn't say to take anything extra. When I got COVID on week 15, that's when we started the baby aspirin. So I don't know. I mean, I'd never been pregnant before. I don't know if that was going to be a normal routine thing to eventually start me on that anyways, but I know they were really concerned with COVID and blood clots in pregnancy. So yeah, I don't know if that's a normal thing or that they were already going to do, or if it was just because COVID presented.
And I guess this was still in 2020, correct?
Correct.
So this was pre-vaccine?
Yeah, there was talk that it was going to be, something coming out, but nothing was out yet.
When you got COVID, were you very sick with it, or just sort of like, oh, I got a cold, I tested positive, kind of annoying, I got to quarantine for a week? Like, which way was it?
It was a little bit of a cold at the beginning, and then it turned into just extreme body aches. And my husband, he got it as well. His was more of a straight cold. He was done in 2 days. Mine was just like my back just hurt so bad. It just hurt even to lay down. But after about a week, I felt normal again. And it was, I honestly felt fine. But yeah, a little bit of a cold at the beginning, but more body aches and fatigue.
Okay, but you didn't have to be hospitalized or anything like that?
No, I did not. No.
Okay. All right. So you got the COVID, you're on the baby aspirin, and then how did things progress from there?
Yeah, so we get the COVID and, everything was going fine. We were having our just normal checkups. We did the genetic testing, found out she was a girl, and we're having our normal ultrasounds, of course, because of COVID. Luke couldn't come to a lot of those. So it's just, me on my own, but everything was normal still. So I felt comfortable and I was fine. At my week 25 appointment. So I had met at this practice, there's multiple OBs and you kind of rotate through them. I don't know if that's normal or not.
Mm-hmm. Frequently, yeah.
Okay. So, I find one that I haven't had yet. And he said that they'd done the ultrasound earlier that day and she's kind of measuring petitely. Nothing that he was crazily concerned about, but he said, I've gone back through your records with us. Your blood pressure has never been elevated while you've been with us pregnant. And he just kind of wondered if he could get me off the medication, the blood pressure medication, if that would help not restrict her growth because she was already measuring petitely. And actually, my husband was able thankfully, to go to this appointment with me. So we both kind of were like, really? Like, we just can come off of it. And he said, sometimes our bodies change. Pregnancy, he said, yeah, you've never been elevated. And I mean, thinking back now, I wish I would have asked more questions when he brings all this up. But, I'm just looking at him as the doctor and, he knows more than I do, obviously. And he's, I'd just like to try to get you off of it.
Right. Right. What would you do? You know what your dose was at the time? I'm just curious. Was it a lot? Is it a high dose or a small dose?
It wasn't super high. I'm not exactly sure what it was at the time, but I think it was just like a normal. It wasn't anything crazy.
Right. And were your blood pressures like running kind of normal, or were they running on the low side?
No, they were actually normal. They weren't low.
It's actually not an unreasonable sort of premise at the time that, we used, and when I say used to, I mean, there was like a study that came out like 2 weeks ago, but basically like up until now, and for many places still now, you really wouldn't treat high blood pressure unless it sort of got to a more dangerous range, like a severe range, like 160 over 105. And the thought was that the medications might affect the baby's growth negatively. That if you're sort of decreasing blood pressure to the uterus, you're going to like decrease nutrients and the baby's, isn't going to grow so well. And so it actually, it's not that uncommon that even if the baby wasn't measuring small, to sort of take someone like you who has kind of a mild, stable, hypertension, and in pregnancy sort of reduce your medication and see how it goes, and then maybe go back on it. So I can see what he was thinking, that like, hey, like sometimes we do this anyways, maybe let's try it and see if it helps the baby grow. So I don't think it was a crazy idea, to try that per se at the time. Yeah, I mean, I don't know if it worked or didn't work or whatever, if it had anything to do with what happened to you, but it's not that far out of left field is what I'm saying.
And it wasn't anything either that I thought like about asking, like, do we wean off? Is it just something he basically just said, because I take it every night before bed. He said, tonight, don't take it.
Yeah.
You have your at-home cuff, just monitor it. Obviously, if you start to see or feel differently, immediately call us. So we were pretty excited actually, because I kept thinking, well, this is great. Maybe my body has changed and I don't need to be on it and she won't be restricted. And, we were excited. Thinking back now, I'm like, oh gosh, I was kind of optimistic. I should have asked more questions, but
Yeah.
so that night I didn't take it, went to bed, didn't feel any differently. Around 3 a.m., I woke up with a lot of bleeding.
Whoa.
Yeah, a lot of bleeding. And I knew, obviously they tell you, a little bit of bleeding's okay, you know, but this was more than I was comfortable with. I woke my husband up. He's like, yeah, I think we should call.
Mm-hmm.
So he called like the after hours number, got the OB on call, who happened to be the very first doctor I saw ever at the practice. He was like, yeah, it might be something that we need to look at. I don't want you just to, lay back down. Why don't you meet me at the ER? So we're like, okay. And that was scary. Obviously bleeding, you think,
Yeah.
obviously not good things, especially, and I'm, pretty early still.
Right. Was your blood pressure very high?
No, it was normal at the time. Like when I took it at home, I was
Mm-hmm.
okay.
Yeah.
So
Wow.
that even really wasn't going through my head either. But then we get to the ER, they hook me up. I don't really have the big of a belly yet. So they're like awkwardly trying to get like the monitor on to find her. Found her. She sounded great. They checked my blood pressure and it is like stroke level, apparently.
Wow.
When they kept asking, like, do you feel okay? And I said, I feel fine. And she said, you don't have any headache.
You sure? You sure you feel okay?
She's like, you sure? I'm like, I know what a blood pressure headache feels like. It's that awkward, like, just gotta like pop your head type feeling. I said, I'm not having that. I have no floaters. She said, can you see straight? I said, I am absolutely fine, except this bleeding. So they were, really concerned with that. He, of course, he comes in. My husband and I explained to him what the doctor, literally just the evening before had told us. And he was a little upset. He was like, the reason it was controlled and why we had you on it is because, the medicine was doing the job. He's like, obviously your body needs this. So they started the blood pressure medicine back through IV, I believe. And with the bleeding and everything, they sent me to do an ultrasound and he did an exam and he found a blood clot on my cervix.
Probably above.
Yeah, maybe a little, okay. And he said something about like the way she was positioned, thought maybe she was like rubbing on it a little bit is why I was really noticing the bleeding. But that the placenta was in good position and everything else seemed fine. So, I mean, that was positive. That was, good, better news than what I thought we were going to get that night, to be honest. Said everything looked good. He just wanted us basically to do a modified bed rest. So he sent us home, said modified bed rest and to do a follow-up appointment just so they could check that clot again to make sure, was it changing size? Was it moving? They wanted to, kind of watch over it.
Okay.
He kept saying, I think it will resolve itself. I think, you're noticing it again because of where her head is positioned.
I'm just curious, in your headspace now, are you thinking this all happened because I didn't take my medication once?
110%. Which, and who knows,
Yeah, I don't know. I mean, I'm not saying one way or another. Maybe yes, maybe no. There's no way to know. It would be unusual to miss one dose of a labetalol and to have that happen, but I don't know. I mean, it did happen the same day. It's hard to say. And I think it's, it's interesting because listen, I'm a maternal fetal medicine specialist. Of course, I'm biased in these things, but it doesn't have to be an MFM, but it just seems it's one of these situations where, especially when, and we have this in our own practice, it's a group practice. You have a lot of different doctors. It's one of these situations where, when someone walks into pregnancy with a condition or with a unique circumstance or whatever it is, to have some sort of like sit down, you and, the doctor or whoever it might be, and like, all right, this is going to be our plan, right? This is what we're doing. And you sort of map it out. You like write it out. We're going to do this medication. We're going to do this at this week. This is this week. What is our goal blood pressure going to be for your medication? So everyone's on the same page. And then you don't get sort of like, oh, he's doing this and she's doing that and that person's doing this, because whether it actually leads to better outcomes, I don't know. Maybe yes, maybe no. I would like to think yes, but maybe not. But just from your own mind, had you sort of entered into the whole pregnancy with a plan saying, all right, these are our blood pressure parameters. All right, I'm going to take medication if it's above this, and I'm not going to take it if it's below this. And then you're not going to have that sort of feeling in your head that something was done sort of haphazard and it caused all these problems. Again, whether it's actually the way it happened or not. And I just think that, it's one of these situations. That's why I asked, did you meet with someone with this? Because just to have a plan in place, I think gives people a lot of comfort that there's like a roadmap for how this is going to play out.
Oh, for sure. Yeah, that would have given me so much peace of mind because I just felt like, every different person I saw, and I get it, you want to rotate, you want to be familiar, you never know who would be on call for delivery. But it seemed like one person had an idea of what was supposed to happen with my pregnancy, and then I would see the other one, and it's almost like they almost had a different route in their mind, and I would have just liked a nice cohesive plan.
Yeah.
So I could have just felt like, okay, we're all on the same page, we all don't understand what's going on, because I just felt a little bit like everything was up in the air.
Yeah. I mean, and it's not an MFM thing versus an OBGYN thing, because you don't have to be an MFM to know how to manage blood pressure in pregnancy. Not at all. It's one of these things. And again, it's tough because, I practice in a group practice and we're a big group and we have the same challenges because we're all different people and we're different personalities and we have different tolerance for risk. And, that's normal amongst doctors to have variation in this. But we have to practice together. We have to take care of the same set of patients. So either you have to make a decision, all right, I see this patient, you see this patient, you see this patient. We do it the whole way, the whole pregnancy, and just, we sort of split it up at delivery, which is okay. That's one model. Or to sort of say, we have to get on the same page somehow. We have to just decide as a group what we're doing, either in general or for each particular patient. And that's hard. It takes a lot of coordination to do that. And it's something we struggle with. I mean, we try our very, very best to do it. And hopefully we succeed most of the time, but it's not always easy to do. But you sort of get caught in the middle of that. And it's hard.
Yeah. Yeah.
Wow. All right. So you're home, you're on modified bed rest, and he thought everything was going to resolve. How did it go?
So we went to the follow-up that was, I don't know, maybe a few days later. And the ultrasound tech did an ultrasound. She said everything looked good and that the clot appeared to be smaller. So that was promising. And everybody was happy with that. And it was like, okay, my husband and I kind of took a breath, like, all right, that's it. We'll stay on the medication. They're going to monitor us really closely. Everything's going to be fine. And they took my blood pressure that day in the office and it was fine and normal. I've been taking it at home and it was fine. So they wanted to see me again in a week. They could keep monitoring that clot. So we went home and everything seemed normal. A few days before the next appointment, I started having what I thought was like a trapped gas pain, like in my upper right abdomen.
Oh, that's a bad place to have pain.
Yeah, apparently. I did not know that. I just,
Right.
I don't know, naive me was just like, "Oh gosh, like, what did I eat? What
Right.
happened?"
Upper right abdomen and in the middle of your head. Those are two bad
Yeah.
places to have with a high blood pressure. Okay.
So, my husband, I'm like, "I don't know, I got this pain." He's like, "All right, maybe you just got a little bit trapped gas." So here we are, not doing full on yoga, but like, trying to do like the cat pose. He's like, "Maybe that'll get things moving, what can we do here?" And of course that didn't help. And I was, maybe taking like some Tums or something, thinking like, okay, maybe I just, have really bad like heartburn. Like I
Right.
couldn't pinpoint. And it never really had, other than describing that it felt like trapped gas. That's the only thing that I had to reference it to, but nothing else.
Mhm. Did you go to the Google or anything like that?
No, not yet. I
All
did
right.
not. Which I don't know if that would have helped or not. I mean,
No, I'm not recommending it as a source of information in this circumstance. I'm just curious. A lot of people say I went to Google and they said, yeah, you have a broken rib or whatever. They Google misdiagnosed me, which happens. Google's sometimes not so good with these things.
right, yeah. No, I didn't Google, but the pain was getting like increasingly worse, and like over the next couple days, I mean, it was kind of starting to move like around my side to the back, and he was trying to like rub my back, thinking like, I don't know, like maybe again trap gas. I don't know. I'm like, listen, we're not getting any relief, and he kept saying, do you want to call them? But I mean, nothing else was happening. You know what I mean? It was
Yeah.
like nothing else was going on. I felt fine other than that. And I kept thinking, well, I have an appointment on Friday. Maybe I'll just wait. And he had had enough of it. He was like, absolutely not. You're calling. Something seems wrong. Like, this is not normal. I mean, I couldn't sleep. Like, I just couldn't get relief at all. I did just wait for the Friday appointment.
So even though Luke said you're calling, you're like, I
Yes.
am overruling you. I'm not calling.
Yes, correct.
I'm
Sorry. I
pregnant.
was like,
I'm not calling. Good for you.
yeah.
All right, listen, I do like that the persistence. I think that's cool. Go
I
for
was
it.
like, I'm okay.
Yeah, but listen,
I went,
what would you know? I mean, you're like it's not like, you don't have a high fever, your blood pressure's not crazy, you're not bleeding, like you're like I'm having pain in my right, like I can wait. What's a big deal? Like I'm not gonna call because I'm having some pain. Like, yeah, I hear you.
exactly.
And that's a normal sort of response, from people like, oh, I'll just wait till Friday. What's a big deal? It's all cool.
Right. Yeah. So I went Friday. It was, the ultrasound first, and I mentioned to her, and she was like, "Yeah, mention that to the nurse, mention that to the doctor." So I get in the regular room, and I tell the nurse, and she's like, "Oh, yeah, that can happen with pregnancy." I tell the doctor when she comes in, she's like, "Yeah, everybody just kind of kept brushing it off as trap gas can happen with pregnancy. Trap gas can happen with pregnancy."
Mm-hmm.
To the point where I almost started to get embarrassed to bring it up, because in my head it was like, if you can't handle this trapped gas pain, how in the world are you gonna handle, labor?
Yeah.
Thinking back now, obviously, it
Yeah.
wasn't
Yeah.
obviously trapped gas, but
And your blood pressure was good, right? Still good?
it was still fine. It
Okay.
was still fine. They would check it and everything was fine.
Yeah.
So, went home. Then, a couple days after that appointment is when it really got bad. And he was like, "No, I am overriding you
Yeah.
this time. You will call." So we called, and at first, you just get the nurse on the nurse station, and she was like, "What have you tried?" Yeah, like some Mylanta. Have you tried like anything? And I'm like, I don't know. So she said Malox may give you some relief. So Luke runs down the road before he goes to work, grabs some, drops it off. He's like, I gotta go. Drink this. Let me know how you feel.
Mm-hmm.
So I swig it down, and she calls me back from the OB office. She's like, "Listen, I'm going through your chart more. I see you have the blood clot already. I've already consulted the doctor. We don't feel comfortable with you being at home. We want you to go to the ER."
Yeah.
And she didn't sound like, like anything was dire.
No, just to be cautious. Just to double check.
Better safe than sorry.
It's the right call.
Yeah.
9 out of 10 times, nothing's going on. Absolutely.
And I even thought that, but it's all right. I'll send an email or two and I'll go. So, I get dressed. We had the little dog, and at the time he couldn't stay at home very well by himself. So I packed the dog up, dropped the dog off at doggy daycare, and I go to the ER. And I didn't call Luke because I told him I was going to the ER, but I didn't say like, "Hey, meet me there," because I didn't know what was gonna happen. You know what I mean?
Yeah.
I honestly thought, they'll hook me up. Maybe they'll give me something for pain, and I'll be home.
Mm-hmm.
So the ER had already been called by the office, knew that I was coming in. The ER doctor, he looked at me and he said, this is kind of out of my realm. I'd like to call labor and delivery down to look at you. Just with you being, you're early, you're 27 weeks, you're having a lot of pain, and your blood pressure is extremely high.
Oh, it was extremely high at that point.
Yeah.
Oh,
At
okay.
the ER, yes.
Yeah,
So,
okay.
yeah, it had been fine at home. Then the pain got really bad.
Every time you go to the ER, your blood pressure's high, and at home it's
Right.
fine.
I'm like, maybe it's you guys. Like,
Yeah.
what is happening?
Yeah.
You're stressing me
You
out.
people are freaking me out over here. Yeah.
Yeah.
Okay.
So, and they kept fumbling with it. Like one nurse would come in, try to get the cuff, and she's like, this one's too big. It's not reading right.
This one's too
And
small.
then
This one's too big. Yeah.
yes, yeah, it's like, we can't get this right. And every single one of them that kept coming in, it was like, that can't be right. There's no way that's right.
All right. Are you sure you feel okay other than your pain there? The same question. You sure you don't have a headache?
Right. Again, I'm just sitting there like, I don't know, I just have this stomach pain. Like nothing's working. So a labor and delivery nurse comes down. Immediately she walks in and she's like, oh my gosh, I don't know what they're doing with your blood pressure because there's no way this is right. So she takes it herself manually and she very calmly said, I'd like you to call your husband. We're going upstairs because I think we're going to deliver you today. And I had no idea what was even happening. I mean, didn't expect in a million years that that's what she was going to say. And I was, I'm confused because I'm like, I'm not even near close to ready. You know what I mean? Nothing in my head said, oh, you're going to go today and have a baby.
Mm-hmm.
So I called Luke and it's fuzzy. I don't even know. I think I just told him, I think they're going to take the baby today. And he's like, what? What are you talking about? You just went in for like some stomach pain. I'm not sure what's going on.
What was it that she thought you'd be delivered as opposed to getting admitted, getting magnesium, getting steroids, like all the things that you would typically do if it's related to high blood pressure?
I am not exactly sure.
Mm-hmm.
She didn't really say. Because I thought like, oh, okay, we'll go upstairs. Maybe they'll just watch me for a day or two. You know what I
Right.
mean? Then
Yeah,
send
yeah.
me home on like real bed rest maybe. But no, she kind of just made it. She was real calm. So maybe she was just, I don't know, maybe just making sure that my husband would get there. I'm not exactly sure. Thankfully, he's a real estate appraiser, so he happened to be doing a home inspection down the road, so he was really close. He got there pretty fast. And from there, once he got there, I mean, the doctor came in and she, everybody was kind of moving around me, but not talking to me. So we, a little confusion. And then she just finally said, she has something called HELLP Syndrome, and the only cure is delivery. And I'd heard of the term before. I actually had a coworker's sister who had it recently at that time, but I really wasn't like familiar with what actually, was happening or what was going on with my body. And she said, at this hospital, we don't have a NICU, but the hospital across town has a NICU. So I'd like to transfer you if possible. They're going to want to meet with you, and then we'd make a plan, or they would make a plan
Right.
and deliver you.
Had they drawn blood work on you in the emergency room? Is that how they made the diagnosis?
Yeah, they did all the blood work. I think my blood platelet count was like 14,000.
Oh, God. Yeah, that is pretty bad. All right.
Yeah, I had the protein in the urine. My blood pressure was just like extremely high. So she's explaining kind of, how we're going to transport me, what the plan would be. And the nurse interrupted her and said, baby's heart rate just dropped.
Oh, God.
And she said, okay, yeah. So she's like, okay, give her a second. Let her see if she can recover. And she gave her a moment and she dropped again. And she said that she didn't feel comfortable transporting, that she would just call a code and deliver me here.
And I assume because your platelets had to put you to sleep for that C-section.
They did. Yeah. So, and everything from there, I mean, was really fuzzy. I mean, I just remember, there were a lot of people in the room. They take me away. My husband doesn't get to come with me. They're putting me to sleep. And it's just a very,
Wow.
very odd experience. I mean, it's not what either of us expected. We didn't even get to talk. I mean, they literally just grabbed the bag or the bed and just took me out of the room. So
they're figuring they're saving your daughter's life and
right.
Probably your life too. Tell me about waking up from that, right? Because you have this whole whirlwind, but then they knock you out. So you're asleep. You don't know what's going on during the operation. All the next thing that you're going to have is a memory of waking up somewhere. So where'd you wake up, like that you remember?
I woke up back in that same labor and delivery room.
Like you never went anywhere.
Yeah. It's almost like I didn't even leave.
Wow.
They started the magnesium, and it was really, I did not take well to it. I could barely open my eyes. I feel like I just couldn't focus. My body felt heavy and just fatigued. I could hear, Luke saying, if you look over, there's Laurel. And sure enough, in this crazy plastic box, and
Hmm.
she's, in a bag. And I can't even make out, I mean, it sounds horrible, but like I couldn't even make out that there was like a baby in there.
Yeah,
It was
yeah.
it was
I mean,
the
they're pretty.
strangest thing.
How big was she when she was born? A couple pounds?
She was 1 pound 15 ounces.
Yeah, I mean, they're small.
Yeah, so small.
I assume they were going to transport her and you to the other hospital at this point, right?
So they were definitely going to transport her, but they did not transport me.
You were separate?
Yeah, yeah.
Oh,
So they
oh
they
no.
took her over. Yeah, I got we got like a minute or two, and Luke videoed it because I really don't. I don't remember too much of it.
Hmm.
So thankfully, he's videoing it and taking pictures. So they took her across town, and I stayed, which, not the most ideal situation. I would have rather been, and obviously in the same hospital would have been
Right,
simpler on him, because he's going back and forth now
right.
to visit us. So it was very, very strange.
How long did you have to stay in the hospital after delivery?
So I had her on a Tuesday, and I was discharged on a Saturday. But before I was discharged, like the day after delivery, I was starting to feel better, and like they said, okay, we're gonna get you up out of the bed today. We're gonna take a shower. We're gonna feel like a person again. I said, okay, like this is great. Like let's feel normal again. So like they take my catheter out. I get a shower, and as soon as we're done with the shower, I realized I can't breathe very well. Like it was hard for me to get like a full breath. And I thought like, am I having like a panic attack? Or like, is this anxiety? So they walked me back and put me in bed, and they said, I think I'm having a panic attack. Like I can't breathe. So, the nurse comes in, a bunch of other people come in, and they're thinking I had pulmonary edema.
Hmm.
So, they took me and got some scans. And they started me on, was it diuretics?
Yeah, some sort of
Yeah,
diuretic.
yeah,
They were
and then
correct.
a breathing
It
treatment.
was pulmonary edema. Is that correct?
It was, yeah, it was
Okay.
pulmonary
All
edema.
right.
So
Listen, better than a blood clot, because that's the other thing it could have been. And pulmonary edema is much easier to treat than, because it's a short term thing versus getting a
right, yeah,
blood clot
that's
in
what
your
she
lungs.
was. Yes, the one nurse was like, this is the best case scenario. We just need to treat this so it can, resolve. After that happened, I woke up, the next morning and thought, okay, now I feel human. Like I feel normal. I can keep my eyes open. I can breathe. So yeah.
Yeah, no, listen, based on how sick you were, Tuesday to go home on Saturday is pretty good. That's 4 days, and because you were really sick. And so that's pretty awesome for you.
Yeah, we kept thinking, I mean, I was kind of persistent, like, I want to leave, I want to be out of here, I
Yeah.
want to go see her. And they were like, you're really sick, you need to stay here. And,
Yeah.
he's like, as long as you're monitoring everything, you feel okay, I'll release you on Saturday. So, I mean, thankfully, nothing else bad happened.
And how long was Laurel in the NICU?
She was in the NICU for 86 days.
86 days. So that's like just under 3 months.
Yeah, yeah. Yeah, she almost went home on her due date, but she failed her car seat test.
She
Yeah,
couldn't
God bless
drive
her.
yet. Yeah.
She couldn't drive yet now. So she failed. So they wanted to, hold her for that day and see if she could try again the next day. And so next day she passed, and they sent us home, thankfully.
Wow.
Yeah.
And how's she doing now?
She's doing great now. So they had found that she had elevated TSH in the
Uh-huh.
NICU. So she came home on a thyroid medication.
Uh-huh.
So we'll be on that for like year 3 of life, I think he said.
Uh-huh.
So we came home on thyroid. We did not come home on oxygen.
Wow.
So yeah, and we see her cardiologist, and he said everything's been great. She did develop ROP
Uh-huh.
in the eye, so she had to have the Avastin injections,
Uh-huh.
and that has since resolved. And he thinks we're past the point. He doesn't think, that anything would come back.
Right. ROP is retinopathy of prematurity. It's just for our listeners. It's an eye issue that premature babies. I mean, anyone can get it, but it's of prematurity. I mean, it's much more common premature babies to have that. If she was born in June, right? When was she due? I guess it must have been September.
Yeah, she was due September 1st.
Right. So we're recording this in April. So even though she's, whatever it is, she's 10 months old, she's really 7 months corrected.
Correct. Yes.
Something like that. Wow. Okay. That's awesome. Wow. What was it like coming home with her?
Stressful.
Really? Okay.
Yeah.
Because
Yeah. I
because
mean,
because she's been under like intense surveillance for 90 days and now it's just you guys?
yeah. Yeah. I mean, and they would say, don't look at the monitors because every time you'd start, you could see her trending down. 'Cause there for a while it was kind of touch and go, and there were nights where she was having a lot of, she'd have a spell, they called them, and they'd have to like give her some stimulation to kind of remind her to breathe. And pulling that monitor off of her, I mean, and then coming home just being like, okay, here you go. It's like, how do I know if she's breathing? Like, how do I know she's okay? So, that was
Right.
stressful.
That's why they
And,
do the car seat test.
yeah, they did the car seat test. I mean, and we had, thank God my coworkers, they had bought us an outlet. And I mean, I know that's not the best medical practice, but it was something that gave us peace of mind a little bit, in the night. So, yeah, it was stressful, and we were worried, obviously, just her lungs still, she was still so small. She came home, I think, a little over 6 pounds, and with the pandemic and everything, it was like we were just so scared for her to get sick and have to take her back there. We were just so scared.
Wow. Wow. Well, looking back on all this now, I mean, it's not a year out, but it's several months out. What do you think about all this? When you look back on it now that you're telling your story.
It's amazing what a baby can do outside of the womb. I didn't know that. I didn't realize, and I was probably naive. I mean, I didn't realize babies born that young could thrive and do so well. So it's definitely a, you know, teaching moment for me, that's for sure. But she's surpassed, everything. She's doing exactly what, a 7-month adjusted baby should be doing. She's hitting those milestones, and it's miraculous to watch. Literally watch a miracle happen in a plastic incubator. It's incredible.
Wow. And what about your own experience that how, suddenly you're so sick, right? You go from basically thinking you got a little bit of a, whatever, like some gas pain to, you and your baby could die if we don't do this right away. How do you process that?
Yeah, it took me a while. I mean, I still think I'm working through, some things, and there's the therapy and the work being done. So I think just mentally, it's kind of an odd feeling to think that life was that close to being taken away. You know what I mean? I mean, I think they had said had I waited a couple more days, she wouldn't have made it, and if I'd waited a few more days than that, then I, wouldn't have made it either. So just to think like mentally, wow, I don't even. It's hard to process still at this time.
Yeah, no, I hear you. That's some tough stuff to sort through, as you said, and it does take time. Really interesting. And what is it when you said at the beginning that one of the reasons you want to tell your story is the therapeutic aspect, but the other was, you know, for people to hear your story and to take something away from it, other than what you said about sort of like the miracle of what can be done with premature babies and how well they can do with good care. What else would you like people to take away from your incredible story?
Advocate for yourself. When you're pregnant, you're not only advocating for yourself, you're advocating for your baby. And I wish I would have spoke up more. I wish I would have spoke up louder, and trusted my body a little bit more to know that something was wrong. And who knows? I mean, I think about sometimes maybe if I would spoken up, maybe it could have been caught sooner. Maybe it could have been prevented. And I mean, I know through therapy, I've done the work. I know it's not my fault. I know I didn't do anything wrong, but I still wish that I wouldn't have kind of let them brush me off. When I was in the office that day, I wish I would have said like, listen, I am in extreme pain here. I need some help. And I think, you know, just trust your body and know the signs. I think people think, pregnancy, everything's just like, oh, you're fine. Your body will know what to do. And I don't think my body has ever been so unsure of what to do as when I was pregnant. I mean, I just didn't handle it well.
Mhm.
And I just think sometimes if we all just kind of, kept that in the back of our minds that, you know, things can happen and we need to be vocal when something's wrong. It can prevent a lot of things.
Amazing. Great lessons. Bridget, thank you so much for volunteering to tell your story. Obviously, a little scary to hear and scary at the time, obviously, but I'm really glad that you're doing well. And of course, that Laurel's doing well, even though she was born so prematurely, and that she's thriving. And it's really awesome to hear. And, sometimes these stories are both therapeutic, but also they're hard to tell because they bring up a lot of memories, obviously. And I really appreciate it because I do think it's important for people to hear these stories. And thank you so much.
Oh, thank you. I appreciate it. Absolutely. It's definitely, like I said, been therapeutic, and I'm glad I got to share my story.
Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only. It does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan. Paid sponsors of the podcast are not involved in the creation of the podcast or any of the content. Support for our sponsors should not be interpreted as medical advice from the podcast, the host, or the guests.